So it's me again, Jonty. We spoke this morning. I'm a GP, and I wanted to really kind of take us all now to a slightly different space. We've spent a lot of time over the last 2 days thinking about the healthcare team and how they provide care very directly for individuals. And now I want us to really start to get into what I think are some slightly more, well, I think really important opportunities, but also some slightly more complicated issues. And so I'm introducing you to this concept of proactive care, which I know has been mentioned a couple of times. And I think probably Mark first alluded to this right at the beginning of yesterday, when he talked about whether or not we want to be an illness service, or we want to think about how we can become a health system and how we can encourage people to stay healthy and promote wellness and health as a service. And that's really the space that we want to get into a little bit now. Because in order for us to do that, we need to join up data and information across the system. And we've talked a lot about that over the last couple of days and the value of doing that when it comes to teams providing care for individuals. We're going to be talking about depersonalizing that information, and one of the reasons we're going to be talking about that is because we're introducing another group of experts, and Andy is one of those experts, and he'll talk to you a little bit later. So experts who understand how you analyze that data to start to think about how we might anticipate people's needs earlier on, how we might prevent them becoming unwell in the first place. So we already do this a little bit, and you'll remember that Axel mentioned yesterday the opportunities to identify perhaps people who would benefit from a flu jab and haven't had one. We use it to identify people who would benefit from perhaps a health check. We use it to identify people who perhaps would benefit from having some sort of screening, a cervical screening test. And if they haven't attended, we can identify those people, we can get in touch with them, and we can try to ensure that at that level, we're able to intervene earlier and try to be much more preventative in our approach. But I think what we're starting to understand is there's an awful lot more that we can do. And I just wanted to talk about a couple of examples which I hope will illustrate this. So we know that as people become more frail, they're more at risk of having a crisis, of needing care perhaps in an acute setting like a hospital. But we also know that we can prevent that from happening if we develop a much more tailored care plan or approach collectively as a team to supporting those individuals. Now, in order to do that, we need to be able to identify those people who are becoming frail. And what we've been able to do with the help of people like Andy is to identify a number of different characteristics from across different health records. So it might be the number of times people have attended the hospital from a hospital record. It might be the number of different conditions they have from my record as a GP. When we start to bring together that information, it allows us to identify those people who are at risk of becoming more frail, and it then allows us to tailor care more effectively to support those people. But in order to do that, we need a complete picture from across the health and social care setting so that we can identify all of those different factors that will help us to anticipate a problem. And of course, if you remember, it's a little bit like what Sanjay was talking about. So Sanjay talked about the example of a child with asthma. Do you remember? So he was talking, of course, about the value of being able to see information on that child from a number of different settings. But he said something else that I thought was very, very important at the time. And that is that if we were able to look at all children with asthma and look at how they were interacting with the health system, it might give us the opportunity to flag children who are most at risk of having a very severe episode of their asthma, or of sepsis, for example. So he gave some examples that actually we're already getting into that space of being able to be more proactive in delivering care. And of course, much more is possible. There are parts of the world already starting to look at how, by connecting up that data from across the system, they can, for example, identify people who are most at risk of cancer. And we know that's one of the things in this country that we struggle with. So very often we diagnose people with cancer much later. Their prognosis is not as good. But if we could identify that earlier, then it would be incredibly helpful, and it would allow us to potentially treat them and cure them much more effectively than we do. But to do that, we need to be able to look at patterns across both personal characteristics and the way in which people are interacting with the health system to be able to identify those people earlier. So I guess I just wanted to take us then into a conversation that starts to think about what this means. Because it does require us to look at depersonalized information from across a whole population. It does require us to give access to that depersonalized information to analysts like Andy, if we're going to be able to then work out what those patterns are of data that will allow us to identify people earlier. And I think, importantly, from my point of view, we need to then think about how we should consider this kind of information sharing. So at the moment, I consider this kind of information sharing to be an individual care. And the reason I do that is because I know that there will be some people who will benefit as individuals if I can identify them. But we have to recognize that is at the expense of all of those people who won't benefit. So a small group of people will benefit because we'll have identified that they're at risk of cancer. But in order to do that, we've had to look at the whole population's information. So the trade-off here is the privacy of the whole population versus the benefit of a small group of people who we've been able to intervene with earlier and prevent them becoming unwell. And the question is whether in that trade-off, by protecting privacy through depersonalizing information, that is adequate. So by depersonalizing the information for the whole, is that an adequate protection of their privacy so that we can benefit the few who we identify and can intervene earlier with? I hope that makes sense. I'm recognizing we're starting to get into some different uses of data, but there'll be people around who can also help as we go on.